Have a pulse, we're going to begin CPR. We always want to try, if we can, to get the dog on the right side for a couple of reasons. One, when they're on the right side, it gives us the pumping chambers of the heart closest to where we need to be. Our heart, center of our chest, tilted a little to the left. Same with them, tilted a little to the left. So when they're on their right side, we're going to be closer to the pumping chambers of the heart. The other thing, how do we know where to put our hands? Take that leg that's on top and just ever so slightly bend it, just like this wonderful guy does for you all the time, to where that elbow meets the chest. That tells you right there, there's the ventricle on any dog. There's the ventricle. And he's a bigger dog, so I'm going to use 2 hands in doing CPR. And the video throws a lot of numbers out at you. Here's what you need to think. For any size dog, how deep do I compress his chest? All these inches, all these inches, all these. So either way is 1/3 to 1/2 the total depth of their chest. 1/3 to 1/2 the total depth. For any dog, for any person, that's effective for any person. How deep do I go? All these inches. We're all a different size. We're not all made out of the same mold. Well, these guys are, but most guys aren't all the same mold. So we want to do about 1/3 to 1/2 the total depth. You want to get over top of your shoulders as best you can, and you want to make sure that when you're compressing, you come all the way back up so that that chest is at a neutral position. What happens is if I'm getting tired and I'm not coming all the way back up every time I'm doing this.
You get the shallower compression, which means it's not going to get the blood pumping enough in the heart.
Exactly. That's exactly what happens when we're basting a turkey with a turkey baster. And we compress it, we put it in the fluid, and it fills up, and we compress it to put the fluid all over the turkey baster. If I put it down in the fluid, and I don't let up, is it going to fill back up?
No.
The same with the heart. If I don't bring this back to a neutral or resting position, it never fills up, so it never pumps around. What the science showed us in people CPR is that's the most ineffective thing that we've done over the years in CPR, is that we haven't concentrated on compressions coming back to a neutral or resting position. So if you've had people CPR since 2005, the compressions are 30 compressions to 2 breaths. Before that, it was 15. And next year, I would suspect they go to 50 compressions to 2 breaths. Why? We're finding out that pumping this hard is the most important thing that we can do to save any life, pet or people. Pumping this hard. And because we haven't been effective at it, 3 to 5% survival rate in people, less than 1% survival rate in pets. Because we haven't been effective, we have to really concentrate on being effective. Should we ever do CPR on a live animal?
No.
Or on a live person?
No.